Okay, hello AMP2, this is Lisa Reed. We're going to try making these lectures into videos instead of narrated PowerPoints. So far so good, it's worked for AMP1. I did decide to just make this heart lecture into 2 videos, not 3. There is going to be some slides at the end that we will not make it to, and I didn't delete them out of the original PowerPoint. They're just going to still be in there, but you will only be tested over what is covered in the 2 videos. So here we go. You may want to review a couple things, maybe not necessarily for this lecture, but maybe for the next one. You may want to look at the microscopic anatomy of muscle. You may also want to look at action potentials, although you guys just finished that, so maybe not. But when we talk about the cardiac cycle and the conduction of the heart, that will come back up. So if we're talking about the heart and the blood vessels, that would be considered the cardiovascular system. If you include the blood, which we will have in a separate chapter, then you are going to be calling it the circulatory system. It's very important that you know the difference between the pulmonary and systemic circuits. The pulmonary circuit is the circuit that is going from the heart to the lungs, and that is going through the right side of the heart. On both of these circuits, the oxygenated blood that has less oxygen in it, or sometimes it's referred to as deoxygenated blood, that's going to be shown as blue. And then the oxygenated blood that just has received oxygen is going to be called fully oxygenated blood, and that will usually be shown in red. So the pulmonary circuit on this picture is the top part is showing the blood leaving the heart, going to the lungs, getting oxygen, and then coming back to the heart. Then the systemic circuit is shown on the bottom, and I always think this is kind of a weird picture, but it's showing that the blood leaves the heart that's fully oxygenated, goes to all of the body tissues, and that's shown by that kind of net of capillaries at the bottom of that picture. And we're going to get into that in more detail. But goes to all the different body tissues, drops off the oxygen, picks up the carbon dioxide, and then comes back to the heart. So it's very important that you understand both of those circuits and on which side of the heart they occur. The heart itself is located in between the lungs. The base, which you would expect to be the bottom, is actually the superior portion of the heart. It is the wider part, and this is where the blood vessels are attached. They kind of look like a little spaghetti ball of blood vessels, but we'll go through each one. They'll become less confusing. And then the bottom part, the inferior end, is actually called the apex, and it tilts to the left, and it has a pointy part, kind of tapers off. I feel like it's weird that we're measuring this in inches, but anyway, the overall heart weight is 10 ounces. It's about the size of your fist. And that is showing you a view how it nestles right in between the lungs. The walls of the heart have multiple layers. The outer layer is called the epicardium, and that is the serous membrane of the heart. Some places it's kind of got an adipose layer, some fat that you may see when you dissect the heart, and you should be able to see the coronary blood vessels. These are the blood vessels that are bringing the heart itself the blood supply that it needs to continue to contract all the time, and we will talk more about those coronary blood vessels shortly. The inner layer of the heart wall is called the endocardium. This is the inner lining of not only the heart but also the blood vessels, which we will get to. It also covers the valve surfaces, which we will also get to shortly. In between those 2 layers are the myocardium, and this is the layer of cardiac muscle. It is proportional to the workload, so when we look at the left side and the right side of the heart, we're going to notice a difference in the thickness of the myocardium. It also has kind of a spiral structure, and that allows the heart to produce that ringing motion as it contracts. And so there's a picture of what that spiral structure looks like. Okay, there are 4 chambers of the heart, 2 atria or atriums, the right and the left side. They are the superior chambers. They're on the top of the heart. They receive the blood that's returning to the heart. On the outside, you can't really see this in this picture, on the outside of the heart or on the surface of the heart you can see auricles, which we will see when we dissect. And then then the inferior chambers, or the lower chambers, are the ventricles, the right and the left, and they pump blood away from the heart into the arteries, taking the blood either to the lungs or to the body, depending on which ventricle we're talking about. So you should be able to pick those out, giving any heart picture, and know exactly where the blood is coming from and where the blood is going after each chamber. Okay, this talks a little bit about how you could tell the chambers apart from the outside of the heart, and to be honest, that's great on this picture, but it might not be very realistic when we're actually dissecting. So there are some sulcus on the outside that kind of give us a kind of a roadmap or a landmark as to where we are. So there's an atrioventricular sulcus that separates the atria and the ventricles, and then another one that just divides down the right and left side in between the ventricles. But I'll be honest, I think it's way easier to just open that heart up and find out where everything is on the inside. And I don't know how often you would need to use these as landmarks, but there they are. Okay, we're going to use the word septum a lot. The septum divides the right and the left side of the heart. If we're talking specifically the septum in between the atria, we would call it that interatrial septum. More commonly, we might be talking about the wall that divides the right and left ventricle, and that would be called the interventricular septum. Okay, we have 4 valves that we need to know where they are and which chambers they are a part of. So valves throughout the heart make sure that the blood is going in a one-way direction. That's to make sure that the oxygenated blood does not mix with the deoxygenated blood. This helps our body tissues get the most efficient blood that they can receive, having the most amount of oxygen. So the 2 valves in between the atria and the ventricles are called atrioventricular valves, or AV valves for short. They control the blood going from the atria to the ventricle. On the right side, we call it a tricuspid valve because it has 3 cusps or flaps. And on the left side, we call it the bicuspid valve because it has 2 cusps or flaps. I will rarely use the word mitral. I like bicuspid and tricuspid much better. What helps these cusps actually move are chordae tendineae. They are little cords that connect the AV valves to the actual muscles on this says floor of the ventricles. I kind of feel like it's maybe the ventricle wall a little bit more. But there's papillary muscles that are contracting, and when they contract, the chordae tendineae pull those cusps or flaps, controlling the opening and closing of the valves. This process helps prevent the valves from flipping inside out or kind of bulging into the atria when the ventricles contract. It is a very controlled motion. Okay, the other 2 valves are the valves leaving the heart, and those are called semilunar valves. But sometimes that they are shortened in their 2 names, excuse me. So they do control the flow out of the heart into those arteries, and they are opening and closing based on blood flow and pressure. We'll talk about as the pressure builds in the ventricles, that's when these valves are going to open. So the pulmonary valve is the opening leaving the right ventricle. As the blood goes from the right ventricle through the pulmonary valve, it's going to head into the pulmonary trunk and go to the lungs. On the left side, it is called the aortic valve. So it leaves the blood, leaves the left ventricle, goes through the aortic valve, and then into the aorta. So those 2 are easy to remember. And again, not always will you see the word semilunar in there. Sometimes it just might be shortened to pulmonary valve or aortic valve. Okay, there's a close-up view of the AV valves and the semilunar valves. You can see there those cusps or flaps, and you can see those cute little chordae tendineae in there, those little cords. That's where we get the phrase pulling on my heartstrings, is from those chordae tendineae. Okay, let's talk about how the blood flows through the chambers. That blood pathway is absolutely something that you'll need to memorize. And kind of the understanding behind it is going to help you be able to memorize it better, I think. So as the ventricles relax, the pressure drops. And we're talking about, when I say relax, we're talking about the muscle itself. And so those semilunar valves close. And so the blood, we don't want the blood to back up into the ventricles. We want it to head out away from the heart. And so when that happens, the AV valves in between the atria and the ventricle, those open, and that allows the blood to flow from the atria to the ventricles. So then the ventricle fills up with blood, the AV valve closes, and the ventricle actually contracts. That makes the pressure rise inside the ventricle, and that pushes those semilunar valves open, and the blood flows into either the pulmonary trunk or the aorta. If you are just looking at the plain PowerPoint version of this, that's also in your assignments folder, you can play this. This is going to go through the blood pathway. Again, it is very important that you memorize this pathway. You need to know every point if the blood is oxygenated or deoxygenated and what comes next within that pathway. So I encourage you to watch this animation or others that are similar to help you memorize this process. This kind of gives you a play-by-play, a point-by-point, 1 through 11 of where the blood is going next. And so this is very helpful. Although I would encourage you to not just memorize this word for word, but to understand including the pulmonary and systemic circuits too. Sometimes we get real focused on memorizing just this and forget what's happening in the lungs and what's happening in the body. That's included in this blood flow. We kind of get super focused on just the heart, but make sure that you understand what happens in between looking at step 5 and also at step, oh, I can't find it. I'm going to pause you for just a second.